So are there comments or questions from the audience about the 4 talks that you have heard today? These have been wonderful demonstrative presentations speaking about growth, speaking about successful integration, really highlighting what Charles said. Are there comments or questions? I'm seeing many of our known leaders on board. Please turn on your microphone or raise your hand.
Yeah, Christine Gerlach.
Very much. It's so interesting to listen to you and to learn from you all around the world. And I would like to ask Professor Nair about her experience with the virtual visitations of the patients.
Right. Thank you, Christina, for that question. I think when patients can't visit us, definitely Zoom consultations as teleconsultations really help. So if we have seen those patients before, most of the teleconsultations that we've seen those patients in real patients before. So it was not very difficult to see them virtually because we already have a rapport with them. They know us. So when COVID struck, when teleconsultations were put in place, that was not an issue. But we did have some new consultations as well. But that also went off well because they would send us all the details if they have consulted other hospitals. They would send us through emails or WhatsApp. We have dedicated phone for that. So they would send us through that. So once the consultation is over, of course, you can't examine the patient. Definitely, you can listen to their stories, look at their history, look at their findings from before, and look at their lab test results, and we can prescribe medications. Now, our hospital has a facility where we can give them the prescription and they can actually send the prescription to our pharmacy and we would courier medications to them. Or one of their family members would come and collect medications from us. So that's all in place. So it's not very difficult to put that in place actually.
May I ask a second question related to this?
Sure.
So thank you very much. Because we talked about this building rapport, the relationship. How does it work virtually?
Virtually, so that's what I said. So most of the patients that we have had teleconsultations, we have met them before in person, right? And that doesn't mean that we haven't had any first-time consultations. We've had that as well. But I think one of the patients we just saw over Zoom consultation. We've never seen that patient in person, one of them. But I think it all went well, and we certainly have the ability to communicate and ask the questions, and they have enough time. We can visualize them and see if they have a wound. There's somebody to kind of open up and show us. So it's all practical. It's not so difficult as you think. It can be done.
I have a question from Amir.
We have a question from Sheila Payne here in the chat.
So we have a question from Amir. Amir, are you able to put your audio on?
You need to unmute. Yeah.
Oh, can you hear?
Yes, we can now. Oh, sorry. Do it again. Unmute again. Amir, we can't hear you. Just do what you did. There we go. Now we hear you.
Can you hear me now?
Yes.
Okay, I'm sorry for technical problem. So a really great presentation. And I had a question from Professor Nair. In terms of the patient confidentiality, so you are using the Zoom or other media. So did you have any problem or issue with that, or can you share your experience? Because in our part of the world, that would be issue in terms of the share the patient information through the chat room or through the WhatsApp, Zoom or WhatsApp. Thank you.
So thank you for that question, Amir. I think it's a very important issue because I remember once when we were having a presentation and we were having a conference, a small sort of talk somewhere, and then somebody hacked our Zoom meeting, and then they were just going bizarre, and then we had to kind of deconnect from that Zoom meeting and get into another meeting to avoid that hacker. So I agree with you totally. Zoom platforms are not that safe, but it is provided by a hospital, and that is the teleconsultation platform that has been provided to us by the hospital. So I presume that the hospital has put in some restrictions for to protect the database, and people can't steal the patient's data from. So teleconsultation is very common in different parts of the world now.
Yeah.
So I think that should be in place, is my assumption. Although it's a very good point, I must check into this. Thank you for that, Amir.
Thank you.
And if I could comment, you raise a very important point. How do you maintain patient confidentiality? This is a huge issue. WhatsApp is now confidential, even more so than some of the other services. FaceTime is confidential. And in fact, if you set up Zoom properly with a waiting room and you make sure that all those pieces are in place, only people who are permitted in can come in, it actually can be quite acceptable from a HIPAA perspective. So making sure we have confidentiality.
Thank you very much.
Yeah. So I see a comment from Sheila Payne. Sheila, do you want to make her comment in person?
Thank you, Frank, and thank you for all the speakers. So my comment is just to ask the speakers if they would like to respond and tell us about what they did to highlight palliative care services to their public, because many countries, palliative care is closely associated with cancer and not necessarily other conditions. Thank you.
I can comment what happened in our country. In our country, a great attention was put on palliative care because people maybe got in contact with death very closely, and in every family someone died of COVID. So palliative care had some place also in media, in television and newspapers. And me personally, I took part in a roundtable in television when we discussed hospital palliative care services and benefit for patients.
George, I'm interested, how did you market your program? Because you're obviously reaching the public with your courses. How do you get the presence out there?
Yeah, I don't know. It's by word of mouth, basically. And then journalists contact us. We very rarely write a press release. It's usually the press contacting us. And then we come in the television or in the media and whatsoever. And we really try to encourage people to have early palliative care and to say, okay, have a palliative care consultation early in the phase of your disease, not only cancer. That's what we do.
Shoba, do you want to comment about how that's happened in Kerala? And you've had palliative care for a very long time in the state. But how did this raise the opportunity for you to have more patients? You doubled the load.
Right. Yes, Frank. Thank you. So I think myself and my colleague, Dr. Rajashree, who is attending this conference, we were fortunate enough to be part of a team who prepared a handbook on palliative care in COVID-19 when the pandemic struck to begin with. So there were other leaders you trained, Frank, like Chitra, and so all of us worked together, and we've come up with this handbook, which was actually incorporated into the government protocol in Kerala to provide palliative care in COVID-19 patients. So depending on different symptoms and providing end-of-life care, like triaging patients? Where do they go? Do they go to the ICU, or do they get symptom management just outside the ICU? But answering Dr. Sheila Payne's question, I think it's a little tricky, because the awareness about palliative care in Kerala is very high compared to other states in India. So we didn't have to do anything particular to reach to the population, because it's already done. So I think we're fortunate to be part of that team, and we could implement that at a government level, because palliative care was very much part of looking after patients with COVID-19. I can't vouch for the what is a ground reality, but in the government setup, but in our institution, when patients were referred to us, I think for them, we could provide end-of-life care as it should be.
There's one more question, and I think it's a very good one. It's in the chat. It's for George, which is, how are you planning to assess the impact of the last aid course in the community?
Yeah, that's in fact a really good question. And we are doing that. We have established a last aid research group Europe, which is expanding to other countries of the world too. And we are doing this using a questionnaire in the first place to hear what the people's views are. And then we are planning long-term studies where we plan to contact the last aid course participants after 6 months and 12 months and 2 years via telephone interviews. This is the one part of it. And the other is, of course, that we could see if this has an influence of the number of home deaths. But this is a multifactorial.
That's wonderful. Well, so I'd like to thank all the speakers from this session, and thank Dr. Charles van Gunten, George, Shobha, and Susanna for giving us an image of what they have been able to do in their careers